Welcome to another easy nursing review. In this video, we will cover diabetes insipidus.
For more nursing reviews to help you pass nursing school, like and subscribe for more videos like this.
Now, let's begin by first learning what diabetes insipidus is. This disease occurs when there is either a decrease in the production of an antidiuretic hormone by the hypothalamus or an increase in the production of ADH by the pituitary compromises the ability of the kidneys to concentrate urine. This results in the excretion of large amounts of diluted urine. The patient then drinks large amounts of fluid to replace the increased urine output. Important to know. This disease cannot be controlled by limiting fluid intake, because the high volume loss of urine continues even without fluid replacement. Attempts to restrict fluids cause the patient to experience an insatiable craving for fluid and to develop hypernatremia and severe dehydration. Now, let's go over the signs and symptoms of the patient. The patient will experience polyuria and polydipsia. Polyuria is when there are enormous daily output of very dilute urine. The key symptom to note is dilute urine. Polydipsia is when the patient experiences intense thirst, such as drinking 2 to 20 liters of fluid daily. Note that the patient will continue to have polyuria even without fluid replacement. Additional symptoms also include the following because a patient has inadequate fluid in their body. The patient will experience hypotension, tachycardia, and weight loss will develop. If the patient is not treated right away, they may also have a symptom of vascular collapse, which may develop into shock from the fluid loss. Another sign and symptom is hypernatremia. Hypernatremia occurs as a result of this rapid fluid loss. Because sodium is an electrolyte, the patient will display neurological complications such as irritability, decreased cognition, lethargy, and even possibly coma. As a nurse, your assessment skills are crucial. You can help the patient improve if you can catch symptoms early. Now, let's go over important labs and diagnostics. A patient with diabetes insipidus blood work will come back as increased osmolality, increased sodium, and decreased levels of ADH. After collecting a urine sample, the result will be decreased specific gravity less than 1.005 and decreased osmolarity. Urine results will be decreased osmolarity, but blood will be increased osmolality. Exams like to trick you, so pay close attention to this when reading. Other diagnostic tests include the water deprivation test, vasopressin stimulation test, and MRI. The water deprivation test is used to determine the ability of renal tubule to concentrate urine. The patient is positive for diabetes insipidus if after fluid is restricted, there is no change in urine formation. The vasopressin stimulation test is used to determine if ADH is being secreted from the posterior pituitary gland. The patient is positive for diabetes insipidus if after subcutaneous administration of 5 units of aqueous vasopressin, increased specific gravity and decreased urine output occur. Because a person may seem to show signs of diabetes, note that normal blood glucose indicates that diabetes insipidus isn't a complication of diabetes mellitus. This is what makes this disease not blood glucose related. Let's move on and learn about treatments for diabetes insipidus. The overall goals of therapy are 1. To replace ADH, 2. To ensure adequate fluid replacement, and 3. To identify and correct the underlying intracranial pathology. Note that medications are long-term ADH replacement therapy. One of the medications used is desmopressin. This medication is a nasal spray. When administering this, have the patient sit in an upright position which promotes better absorption. This medication can also be given parenteral administration. Typically, this is used for transient diabetes insipidus when use of a nasal spray is impossible due to nasal packing. Another medication used is aqueous vasopressin. This medication can be administered subcutaneous, intramuscularly, or with a nasal spray. With this medication, you will want to monitor the patient's weight and their intake and output. Chlorpropamide. is another medication used. This medication is thought to stimulate the production of ADH and it is used for its antidiuretic effects. With this medication, you will want to monitor for signs of hypoglycemia. The final treatment option for diabetes insipidus is oral and hypotonic IV therapy hydration and replacement. This treatment is given if clinical signs of hypernatremia are present. The goal is to remove sodium while maintaining fluid balance. This treatment is calculated by adding insensible water loss and urinary output to estimated water deficit. While getting this treatment, is it important that this is administered slowly over 48 hours. Here are some interventions a nurse will perform for a patient with diabetes insipidus. Assess for early signs of dehydration and maintain adequate hydration. A nurse will do this by ensuring IV access site and monitor hourly infusion. Next action is to assess neurological status. This is needed because of electrolyte imbalances of sodium. Measure fluid by measuring intake and output. Remember the patient is at risk for fluid deficit. Urge the patient to drink fluids in an amount equal to output. Maintain the patient's fluid by checking their urine-specific gravity and also recording their daily client weight. Another action is to monitor the patient for educational need and ability to participate in their healthcare. Here are the most important points to teach the patient. Teach them to weigh themselves daily using the same scale at the same time of day. Notify healthcare provider if weight loss occur. Notify healthcare provider if polydipsia and polyuria occur because this signals the need for additional medication doses. Wear a MedicAlert bracelet. Teach the patient to always have vasopressin nasal spray with them for temporary symptom relief when needed. Well, that ends this lesson on diabetes insipidus. Test your knowledge with a free quiz. The link is in the description below.